I got about 10 more minutes until 40 milligrams of this Adderall kick in. Let me tell you something, I'm feeling pretty intelligent right now.
Nowadays, it seems like many people find it difficult to pay attention. Oh, sorry. Were you saying something? You hear it all the time. It's just like ADD or I can't focus, someone will say as they scroll down through their Instagram timeline. ADD or ADHD isn't a new diagnosis, but it definitely has become a more prevalent issue in recent years. Yes, the actual amount of diagnoses have increased, but even just the notion of disorder and the drugs used to counteract it have become quite popular. Now, some of you may have noticed my use of the word disorder, an act that is contentious within the medical and the ADHD communities, as our knowledge and the language used to represent it are constantly evolving. Some prefer the term neurotype, as it attributes the notion of difference to the person with ADHD, whereas disorder denotes a fundamental problem within them. This is, in my view, a completely valid position. However, today I will be using terminology rooted in the DSM to simplify our quest to develop a basic understanding of ADHD. No matter your positionality on the language used to describe it, ADHD is at the forefront of the cultural zeitgeist, and the writing is on the wall. Many people are having difficulty focusing, and many of them feel pressure to quote unquote fix their problem. And as a medical professional who was clinically diagnosed with ADHD some 30 years ago, it's hard not to take notice. And as with many of the topics we cover on this channel, the disorder and its treatment protocol are intimately linked with the society in which it exists. Over the course of this series, and yes, we'll need a couple of weeks to wrap our heads around this stuff, we'll explore both ADHD, common treatment pathways, and their relationship with society, as well as the way in which society influences those with ADHD. Once we're armed with a basic understanding, we'll tackle some difficult questions. Is it right to expect a person with ADHD to take a medication that amounts to legal speed?
So yes, as you've heard, they are speed. Amphetamine is speed.
In order to function day to day in modern society? Is it possible to develop treatment modalities that support those of us with ADHD enough to leave stimulant medication behind? How might society change to allow people with ADHD to flourish within it? Surely an enhanced understanding of ADHD might serve us in this regard. ADHD, otherwise known as Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that can affect all areas of your life: emotional, physical, interpersonal, familial, and financial. It is described as a persistent pattern of inattention and hyperactivity. Emphasis on persistent pattern. It can cause excessive energy, impulsivity, and emotional ups and downs. I'm sure most of us have experienced those symptoms to some extent, but for someone to be diagnosed with ADHD, it must be evaluated as a condition that interferes with otherwise normal activity.
ADHD greatly affects people's lives, ability to succeed, and self-image.
It is usually diagnosed in childhood, as it often leads to academic difficulties, but people can be diagnosed at any age, even in adulthood. The assessment process is performed by a qualified mental health professional according to official guidelines such as the American Psychiatric Association's Diagnostic and Statistical Manual to ensure that people are appropriately diagnosed. These diagnostic standards contain a set of criteria used to identify a person with ADHD that have been established by various physicians and are generally agreed upon amongst the medical community. But before we proceed, we must acknowledge that the DSM is contentious in its own right, as some believe it perpetuates an oversimplified and outdated understanding of mental health conditions in treatment. Consider the aforementioned ADHD diagnosis protocol. An inattentive or hyperactive child enters the office. Boxes are checked, and if the test is positive, treatment is decided upon. This feels rather black and white. Here's a neurodevelopmental disorder that just exists, and here's how we treat it. But it's multifaceted, and there's more we need to consider moving forward. One brief look at society will reveal a more nuanced picture. If the school systems are rigid, children may be less inclined to learn the material and more likely to be disobedient. If the workplace is highly competitive and profit-driven, employees may feel pressure to perform even at the expense of their own health. If we're always on the internet and social media, on platforms that are simultaneously full of distraction and designed to maximize engagement, people may have problems focusing. If we, as people, value immediate gratification over sustainability, people may have issues paying attention for sustained periods of time. So if our society functions in a way that reinforces short attention spans, no wonder we are all so freaking distracted. What if this disorder, though there is legitimacy in it, was itself a symptom of an underlying issue that our entire society is dealing with? To further complicate matters, although there are several treatment pathways available, therapy, alternative approaches such as meditation, and multiple types of medications, the most popular treatment options are the stimulants. We've already heard from Huberman. I wonder what others have to say.
My friend Duncan Trussell has a great joke about Adderall. Adderall is like someone did coke and they were a scientist and they're like, I can fix this.
This is a huge point of controversy because though they are known to be quite effective in treating ADHD, some consider them to be...
That's a real drug. The idea that there's, like, when we're talking about what drugs are legal and illegal. Like,
I know. Joe is certainly not a doctor. But for those of you who have felt the effect of Adderall or Vyvanse, is there really a counter argument here? And when we consider that these powerful stimulants are being used by many more people than those who actually have a prescription, we begin to understand the magnitude and complexity associated with this issue. I don't intend to stir the pot any further, but did I mention that even the diagnosis of ADHD can be challenging? As far as we know, there are no biomarkers for this disorder. And as a result, we must rely on signs, symptoms, and criteria on a list, many of which are surprisingly general. Here are a list of inattentive symptoms we look for. Often fails to give close attention to details. Often has trouble holding attention on tasks or play activities. Often does not seem to listen when spoken to directly, among others. How about another list of hyperactive symptoms? Often fidgets with or taps hands or feet or squirms in seat. Often leaves seat in situations when remaining seated is expected. Is often on the go, acting as if driven by a motor. Often talks excessively, to name just a few, all of which kind of sound like me. The assessment process doesn't stop there. If enough of those symptoms are present, a few more things need to be confirmed. That these symptoms were occurring since childhood. For example, before the age of 12.
You don't have to be diagnosed as a child, but you have to have significant symptoms going back before the age of 12.
That they impair multiple areas of your life. School, home, work, etc.
But they also need to have what we call functional impairment or kind of evidence of clinical impairment.
They significantly reduce the quality of your life. They aren't able to be better explained by another mental disorder. For example, depression, anxiety, etc. This process relies primarily on patient interviews, but input from family members can be helpful as well. Then, if the patient fits the criteria, the doctor will then determine which of the 3 types of ADHD they have: inattentive, hyperactive, or combination. There you have it, the official diagnostic procedure. And then, with this information in hand, the doctor must determine a treatment pathway. The rates of diagnosis have been rising, and we will discuss why in a bit. But for now, let's just get an idea of how many people are currently living with ADHD. For some, it may feel like...
I mean, sometimes I just get really zoned out, because I'm so focused on what I'm doing that I'm not thinking about anything else.
And for others...
I just really did not have the attention span or interest to go back and carefully review things.
Everyone's interpretation of their symptoms and the extent to which they interfere with daily living will vary. For me, I always felt that it was like I was watching a TV program, but that someone else was controlling the flicker. Anytime I was trying to pay attention to something, the program would randomly change, and I would have to refocus my attention on this new program. So no matter how objective a medical professional is trained to be, there are many layers to consider when diagnosing a potential patient. And although I can safely assume that there are likely many people who fit the criteria who have yet to be diagnosed, for the purposes of our conversation today, we will solely focus on those with an official diagnosis. According to a 2023 meta-analysis performed by Getanet Ayano et al., approximately 8% of children and adolescents have ADHD globally. It is twice as high in boys, 10%, than in girls, 5%, and the most common type is the inattentive type. Another study performed by Dr. Eli Abdel-Noor et al. Found similar stats among youth, and also notes something quite interesting that I want you to keep in mind for later. That is that ADHD is more prevalent overall in the US than in other countries. There are many factors that contribute to the adult ADHD population being lower than the youth. It's not necessarily something you grow out of, but treatment does aim to teach the individual, both practically and neurochemically, how to function effectively in the context of our society. Also, ADHD is typically attributed to children. It's easier to spot when a child is in school. Adults can do what they want and go where they want, whereas a disobedient child in a school setting sticks out like a sore thumb.
People with ADHD are often impulsive, which can get them in trouble. This is especially true for school-aged children.
Because it is usually diagnosed young, and it is a relatively newer disorder that was made official in the mid-1900s, a lot of adults may have missed the earlier waves of diagnoses as children and may be currently living with ADHD symptoms without a diagnosis. When a person has reached adulthood with ADHD, but without a diagnosis, it's much more difficult to address. Some of the issues people have with achieving accurate diagnoses for adults are as follows. Adults have to rely on their own recollection of what happened in the past, since in order to get a diagnosis, you must have exhibited symptoms from childhood. Also, it's quite common for adult ADHD to be already mixed with other disorders, and therefore there can be an overlap of conditions. ADHD has high rates of psychiatric comorbidities, such as behavioral abnormalities, 52%, anxiety, 33%, depression, 17%, and autism, 14%. Sidebar. Going undiagnosed as a child can lead to mental health issues as they grow.
And it's common for people to experience symptoms of depression or anxiety after struggling with attention symptoms for so many years.
What you see is that there is a causal relationship, ADHD leading to depression.
Studies show that it's not just correlated because it does not work the other way around. Growing up with ADHD can lead to social isolation and loneliness. If a person seen as disruptive is excluded from activities, they have less opportunity to practice social skills.
Can't get any XP if you're not invited to the game.
You can imagine how this might contribute to underachievement in the workplace.
Which in turn makes it harder for them to get promoted at work, because a lot of getting promoted at work has to do with social skills.
Of course, shout out to fellow YouTuber Dr. K over on Healthy Gamer GG, who has a lot of great content on the topic for those of you interested in diving deeper. As you can tell, the effects of ADHD can be far-reaching, and a person without a diagnosis might be left confused as to why they have so much difficulty getting their shit together.
They ask you how you are, you just have to say that you're fine when you're not really fine, but you just can't get into it because...
And thus, a life of undiagnosed ADHD may predispose you to depression, or in other words, might lead to factors that later lead to depression. Other things that can affect diagnosis at any age is a gender or racial bias. ADHD is not less common in certain groups, but it is less notable, or in some cases taken less seriously by doctors and teachers. Girls tend to be diagnosed older because of the reinforcement of gender biases. There is more social pressure for girls to be quiet, whereas it's more acceptable for boys to be hyperactive and disruptive in class. So those with these traits are more likely to express them. This leads to earlier detection in boys, while ADHD in girls tends to present itself as the inattentive type and is less likely to be readily noticeable. Other studies showed no true difference in levels of hyperactivity across gender, but under-recognition of hyperactivity in girls. Clinicians also tend to be more responsive to white parents that solicit an ADHD diagnosis than BIPOC parents. In another study, it was reiterated that there are increasing rates of ADHD diagnoses among adults in a 10-year study. However, substantially lower rates of detection among the major racial or ethnic subgroups. So we see that prejudice can even affect diagnosis. Another factor that can lead to underdiagnosis for any age is that people with ADHD tend to be very smart and can easily hide their symptoms if they know they are being watched. As Dr. K mentions here,
kids with ADHD develop compensatory mechanisms, leads to underdiagnosis of ADHD.
For example, if they are being called out for not paying attention, they can quickly clue into the situation and make it seem like they were paying attention or that they might deflect attention elsewhere. And ADHD left untreated has its issues as well, with or without a diagnosis. And even if you are diagnosed, you may not be getting treatment. In fact, only approximately 11% of adults are treated for their symptoms. Deficits in organization and time management can lead to problems in personal, interpersonal, and professional life. Higher rates of dropout and unemployment, lower income, divorce, car accidents, other mental illnesses, and suicide were all reported. People are sometimes worried about ADHD medications leading to future substance abuse, but interestingly,
kids with ADHD who are not treated have a much higher tendency towards illicit drug use and addictive drug potential.
Thanks, Dr. H. Now, even though it can be challenging to diagnose, the rates of diagnosis in general, that is, amongst all ages, are still rising.
The number of ADHD diagnoses in 2010 were almost 5 times what they were in 1999.
Some of the possible reasons for the increase are better access to healthcare, decreased stigma towards mental health conditions, better awareness amongst individuals themselves, parents, educators, and the medical community, and changes in how ADHD itself is defined. It is important to note here how this issue came to be known as ADHD, because it will explain why rates are rising as the definition of it evolves. From the 1900s till our present date, the definition of this disorder has shifted from being a disorder of impulsive and disruptive children to a more inclusive definition that focuses on attention deficit being the defining characteristic. Though it has always included distractibility, the emphasis used to be on overactivity, being hyper. The updating and broadening of the definition resulted in a lot of people whose symptoms were once overlooked because their ADHD typically presented itself as the inattentive type, now being included in the afflicted demographic. One of the most recent additions in 2013 was allowing autism to coexist with ADHD. And since the comorbidity of these two disorders is high, many children that were previously excluded were now included. The increase in the rate of diagnosis is associated with changes to our way of thinking, which is reflected in the society and the systems within it. People are more informed, less discriminatory, with better access to healthcare. However, in our modern world, because we have so much access to information, because we are so aware of what's happening with the people around us, and because these diagnosis criteria are becoming more inclusive, we may be becoming more focused on an issue and ultimately influenced into thinking we have it. Generally, distractibility is becoming more prevalent in our modern technology-driven world amongst the internet-using generation. And the seeming answer to our problem, an ADHD diagnosis, is just a scroll away. In fact, many of us are learning about ADHD through social media itself.
6 struggles that people with ADHD face on a daily basis. No person with ADHD has all 5 things.
Such a chill guy. How do you have ADHD?
The thing about ADHD is that the symptoms are very relatable, and relatability thrives on social media. People like to watch content that resonates with them.
There is lots of misinformation being spread about the disorder. People are making these types of videos, often using pretty general statements, which in turn convinces the next person they also have ADHD, and then they may seek treatment. Approximately 1/2 of ADHD TikTok content was found to be misleading, posted by non-healthcare workers.
So a lot of my patients would hold up their phone to the camera and be like, here's this video that I saw on TikTok, and this is why I have ADHD.
Dr. Sasha Hamdani goes on to say that the ratio of patients who actually fit the ADHD profile versus those who don't is about 50-50. So there is a lot of people who think they actually have it.
I mean, people definitely can have it, but I think it might be over-diagnosed, yeah.
It's so prevalent pop culture that it's trending. In May of 2022, the hashtag ADHD had 11.4 billion views on TikTok. So on the one hand, it may be helpful for those with ADHD to hear about it and feel understood. And at the same time, it may lead people to self-diagnose and convince them that they have this disorder.
We then run the risk of perhaps misconstruing, again, things that are on the spectrum of normal as being pathological.
However, as relatable as it seems, ADHD is more than the inability to focus. To better understand the brain of someone with ADHD, let's talk neuroscience and find out what's actually going on in the brain. It is a complex disorder. Many factors contribute to the development and manifestation of it. 1. Genetics. It's approximately 70% heritable. 2, there are environmental factors, whether that be at home, school, or work. 3, there are also abnormalities in neural network interactions.
Now, attention is not one thing, actually. It involves several different cognitive operations.
As Dr. Huberman further explains, attention is a balance of turning down the noise, that is to say, outside stimulus, that's not relevant to what we want to do, and turning up the focus on particular things in our immediate environment or head or both.
Attention is a powerful resource. It's what allows us to navigate through life with efficiency and to be adaptive in our behaviors.
It's valuable, very literally, in that it requires metabolic resources. That's why it's referred to as paying attention.
Just at rest, your brain would consume about 25% of your daily caloric needs.
So let's get into how we spend that resource. The research into the ADHD brain is still ongoing. The traditional view is that ADHD is due to a deficiency in dopamine and norepinephrine, while more recent research suggests that it's not about the brain being deficient in these chemicals, but that there is dysregulation in the neural networks and their connectivity. They are actually hyper-connected.
That is, they tend to be coactive at times when ordinarily, meaning kids and adults without ADHD, they would not be coactive.
In the most commonly held belief, the ADHD brain is affected by the following: imbalances in neurotransmitters. To refresh your memory, neurotransmitters are chemical messengers that transmit signals from one nerve cell to the next. For example, dopamine and norepinephrine. These two neurotransmitters work together to increase motivation, alertness, and focus.
Tend to be released at similar locations in the brain in order to deliver us to a particular state of mind and or body.
Norepinephrine plays an important role in maintaining optimal level of alertness and arousal, memory, and learning. So if norepinephrine function is impaired, a person may have difficulty staying on task and ignoring distractions. Alternatively, dopamine helps regulate emotions as well as motivation, pleasure, and attention.
Genetic studies have indicated that these individuals may have dysfunctional dopamine release.
An imbalance interferes with the dopamine reward pathway, changing how the ADHD person perceives reward and pleasure. This makes it harder to maintain motivation, especially when the rewards seem not immediate. ADHD brains tend to favor short-term, smaller rewards over long-term, more significant ones. Overall, lower levels of dopamine and norepinephrine lead to inattention, hyperactivity, and impulsivity. Basically, if you don't have enough dopamine, then
it is theorized that the brain is constantly seeking out stimulants, resulting in the distractibility commonly seen in ADHD patients.
Emotional dysregulation symptoms also present in people with ADHD, and an inability to control one's emotions can come across as and often lead to other mood disorders. The ADHD brain is also affected by structural differences in the areas of the brain. This may include alterations in the size, shape, or thickness of specific regions. The frontal cortex, which handles behavior, emotions, and attention, the limbic regions, which handle emotions and motivation, and the basal ganglia, which handles motor learning, picking up skill through practice, and helps regulate emotions, ability to plan, focus, and multitask. The frontal lobe is the region most affected by ADHD. Its key roles are planning, focus, impulse control, communication, problem solving, social behavior, motivation, etc. In the ADHD brain, it matures at a slower rate or shows disrupted activity and interconnectivity. Let's discuss the front part of the frontal lobe, the prefrontal cortex, the manager of neural networks. Groups of nerve cells make neurons, which then group together to make networks. These neural networks are responsible for relaying signals via chemical messengers. Imbalances in their structure and function cause signals to be transmitted less effectively. So, what does the prefrontal cortex do?
Orchestrating which neural circuits are going to be more or less active at a given moment.
It is responsible for executive functions, which it does through a process called top-down inhibition.
The prefrontal cortex really sits in top seat in terms of coordinating the actions, both the shh, the quieting, and the yes, please speak actions of the brain.
It quiets some neural circuits. Remember the turning down of noise we mentioned earlier.
An orchestra conductor that is essentially saying, shh, or not right now, be quiet.
While at the same time coordinating with other neural circuits to increase salience or focus on particular things, thus creating the spotlight of attention. For example, it might
point to a given brain structure and say, you, I'd like to hear more from you right now. Yes, you, the student in the back, speak up.
This is crucial for decision making, impulse control, attention regulation, and task switching, working memory, and goal-directed behavior. ADHD is not a deficit in the prefrontal cortex's function per se, but it alters connections between it and other areas of the brain and their ability to communicate with it.
It is not as good at orchestrating the activity of other brain networks operating in parallel with it.
If your ability to organize, prioritize, plan, focus, remember instructions, and work towards goals is affected, one would have difficulty directing their life. Another important network to mention is the DMN, or Default Mode Network. It handles daydreaming, like when you're not focused on anything external in particular. It is always on, but more so in the ADHD brain, which leads to attention feeling pulled away to unrelated thoughts. Oh, yes, sorry.
It's when we start to attend to something, especially things external to us, that the activity of the default mode network is suppressed somewhat.
Typically, this is done by the prefrontal cortex during the attention process. The salience network is another network affected by ADHD. It helps the brain identify and focus on the most relevant stimuli in the environment and helps it adapt to task demands. It is crucial for switching between the default mode network and the central executive network, facilitating the transition between internal thoughts and external tasks. All of these networks work together in the dance of attention, and the conductor analogy that Dr. Huberman mentioned earlier is key to understanding the way in which the prefrontal cortex works with other parts of the brain.
The teacher to call on one student while the others are quiet, and then to call on a different student, have one student return to their seats, to have the students work in small groups, activate the instruments in that symphony or band in the appropriate order in order to arrive at the right music, as opposed to all the instruments playing at once.
That is to say,
are all allowing these networks to be activated to the precisely correct levels and in the precisely correct sequence.
Therefore, the prefrontal cortex needs to communicate with these various networks for a person to function in an orderly manner. But it can't just be ramped up in activity.
Somebody would become even less efficient at paying attention to what they wanted to.
It needs to be flexible. Otherwise, the person would be locked in on any particular task, not necessarily what they want to be locked in on.
Life, that is an effective, adaptive life, a good life, consists of self-directing one's attention most all of the time.
So we need to get the neural networks in the ADHD brain to work effectively together. Treatment involves counseling, education, skill training, and medication. Meds can help manage symptoms, but they do not provide a cure. Essentially, meds help the brain learn what healthy function feels like.
Enhance the activity of particular circuits to create a sort of learning so that the prefrontal cortex is much more efficient at doing its job of conducting.
The intention is to provide the patient with enough structure so that they can effectively direct their lives. Counseling can give them a better understanding of the condition itself, and it can help them navigate their emotions and address their habitual tendencies. It can also provide strategies for dealing with behavioral challenges so that a person can develop a routine that works for them. Medication can help address the brain imbalances directly and can also facilitate adaptation within the brain through the process of neuroplasticity in two distinct ways. Number one, by helping the patient to maintain new behavioral patterns long enough to strengthen new neural pathways. And number two, by effectively teaching the brain what the neurotypical release of norepinephrine and dopamine feels like, and thereby priming a similar reaction next time attention needs to be paid. And when the connection is strengthened, it's easier to activate next time. The drug isn't creating permanent change, but it is the catalyst of the behavior and chemistry that can. Treatment is individualized, tailored to the person's needs, because ADHD presents itself differently in everyone. And since treatment methods vary, not all people with ADHD take medication to deal with it. though it is most common for treatment to include some sort of prescription medication. Medications used for ADHD are classified as non-stimulant and stimulant medications. Non-stimulants, for example, guanfacine and atomoxetine, were approved for ADHD in 2003. They don't work as fast as stimulants. Some may take a month to kick in, and the effects last approximately 24 hours. Stimulants, conversely, are the most popular treatment option. They have both immediate and powerful effects, like they kick in the same freaking day, yo.
My mind came alive, my body felt alive. It works like a bang.
When discussing which type of medication works better, this is very important. Stimulants don't necessarily work better. They just work faster. This reinforces the belief that they are more effective. Patients think they work better because their effects come on faster and are more noticeable. As Dr. K mentions,
the more rapid the benefit, the more behavioral reinforcement we see.
So, if a patient is given non-stimulants, they don't notice an immediate effect. This leads to
an awareness bias where you can really feel the difference of the medication. Whereas when you're on a slower acting medication, you don't quite feel it as much.
And sometimes the patient wants it to work now. They might have midterms next week.
So sometimes people will need medication because it's the easiest thing to do.
Then they complain. Then general practitioners get that feedback.
You know, I don't blame them, but they'll sort of say like, oh, okay, like, so it seems like stimulants work better.
Now, the doctor is more likely to prescribe the stimulant next time as the first option. See the cycle here? Keep that in mind when people say stimulants work best.
Remember?
For this video, we will focus mainly on stimulant medication as we will go into depth about the controversy surrounding them a bit later.
And these medications are lucrative for the companies that manufacture them, especially as more adults get diagnosed and seek out treatment.
Stimulants as an ADHD treatment were discovered in the 1930s when Dr. Charles Bradley administered amphetamine sulfate to children in the hopes of treating headaches, and then noticed a huge improvement in their behavior and school performance instead. This led to the development of other stimulants.
I just thought I was stupid. Once they figured out I had ADHD, my doctor gave me a stimulant.
Then, with ADHD meds, look at the turnaround.
I felt better. I was able to like myself a little, not get so mad at things. It was easier to organize my day.
They have shown to be very effective in 70% of cases. While data on long-term use is limited, many doctors and patients prefer to use them in treatment. However, it's still controversial to use them in really young children. For patients under 6 years, it's best to start with counseling and to give the parents some tips to deal with their kids at home. In fact, parent training in behavior management has been shown to work as well as medication for ADHD in young children. For school-age children, the most common method is both meds and therapy. Ultimately, the key is for the patient to develop the skills to lead a self-directed and organized life. So getting psychological help is an important part. This is how the medication works in our brains. There are two categories of stimulant: amphetamine, mainly Adderall and Vyvanse, and methylphenidate, mainly Ritalin and Concerta. With the short-term drugs, it takes roughly 30 to 45 minutes until they kick in, and they last approximately 3 to 4 hours. Sometimes longer for Adderall, which is approximately 6 hours. The long-term drugs extend their release so that they last throughout the entire day. They all work similarly, but there are some differences. Adderall is a mix of amphetamine salts,
a close relative of methamphetamine, commonly known as meth.
There are a class of compounds very similar to it, not quite as potent, but that leverages the same underlying mechanisms, and they are very commonly prescribed for ADHD.
It is a compound of D and L amphetamine with a 3-to-1 ratio. These molecules are identical to one another, but are mirror images of one another, leading to different actions in the brain and the body. Most importantly, D is more potent in activating neural circuits. It is stronger because L mainly affects the periphery: heart rate, blood pressure, and sweating.
Whereas D-amphetamine tends to work mainly on receptors in the brain and therefore have effects mainly restricted to the brain.
Vyvanse is D-amphetamine with the amino acid lysine attached to it.
The attaching of lysine to D-amphetamine, what we call Vyvanse, makes it what's called a prodrug. It actually can't have any effect on its own.
Over time, when it is broken down in the gut and the bloodstream, lysines are stripped away from it, making it basically slow-release D-amphetamine. The slower absorption is supposed to help reduce the potential of drug abuse. Ritalin is methylphenidate, which affects dopamine more than epinephrine.
Ritalin was very commonly prescribed for the treatment of ADHD early in the days of using sympathomimetics in order to treat ADHD.
It has a short half-life, which means it doesn't act as long, which is good for people who have trouble sleeping on these stimulant drugs. Note, Adderall is stronger than Ritalin. Also note, a strong drug is effective, but it's important to keep in mind that a substance's addiction potential and psychosis potential is correlated to this.
It increases dopamine very quickly and then brings dopamine down very quickly.
So a big up and then a crash. Still, all of these stimulants run that risk because they are all strong. And with powerful drugs like these in the hands of many people around the world, it's clear why this is such a hot button issue. We're about halfway through our lesson and you've had a lot to digest and contemplate. This is where we'll stop today. But please let me know your thoughts down in the comment section below. Next week, we're going to pick up with how the drugs affect the brain and continue into the controversy surrounding their use and misuse, and how ADHD and the subsequent prescription drug use is being fueled by a high-pressure, competitive, profit-driven society. If you enjoyed the video, be sure to give it a big thumbs up and subscribe to the channel. And if you didn't, be sure to let me know why in the comment section down below. And of course, don't forget to follow me at my online gym, Human 2.0 Fitness, for free right here on YouTube, where we help you move better and prevent injury. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.